everybody. Welcome to another episode of Caregiver Conversation, Aging Matters in Brevard and Sunflower House, coming to you from Space Coast. And Sunflower House is at the Merritt Square Mall, but right now, because of where we are in this crazy upside world, we're needing to do our presentations virtually. So I'd like to welcome from Florida Eye Associates, Dr. Deborah Consbruck and Bridgette Gifford. And thank you very much for joining us today.
Thank you.
Thank you.
Would you like to tell me a little bit about yourselves?
Let's see. I've been at Florida Eye Associates for about 3 years now, over 3 years. And I live in the Merritt Island area. And my parents are here. My sister is here. Family's all around. So we'll be here for a very long time. I love this area. And I was very surprised at all of the different services that Sunflower House offers. So I'll be coming over there frequently, I think.
That's cool. I'm really looking forward to that.
So I have been in Brevard County since the early 80s. And I've worked for Florida Eye for a little over 10 years. I do the marketing and advertising, physician liaison as well. So I go out in the community, do health fairs, call on referring physicians, and make sure that everybody's happy when they're Florida Eye. And I have to say, 99% of the people that I speak with really are happy when they come to Florida Eye.
That's great.
Yeah.
That's great. So Dr. Consbruck, you're going to do a presentation today on taking care of your eyes and different things that are happening.
Yes, I'm going to talk about tips for caregivers. Optometric physician or optometrist. We go by several names there. I'm also a registered dietitian, so I'm going to try to incorporate some information that I think caregivers may find interesting and helpful as I go along with this. But we'll start with just some general tips, things to look for in disease factors. We'll talk about one of the top blinding diseases and their nutrition recommendations that go with that, and ocular surface disease with some nutrition recommendations. And so as Beth mentioned, this is going to be kind of a conversational thing. So hopefully you all will chime in with some questions or things that you might wonder about as we go. So the biggest thing is scheduling that yearly dilated eye exam. A lot of people say, well, I don't know why I would come in. My eyes are fine. I see well. I've got my driver's license, no problems. But there are more reasons than just vision. And that is that, and also specifically a dilated eye exam. Being dilated allows us to look in the very back of your retina for very important things that can be life-changing, like a hole or a tear or a tumor in the eye. And if we catch it early enough, we can treat it. But if we don't catch it early enough, it can lead to blindness.
You know, one of the things, Dr. Consbruck, one of the things that I think that I remember somebody telling me when I first started was it's great to get a baseline, because so many times doctors what they're looking for is changes. So, you know, so it's a change in what you've seen before. So if you've got a baseline, even if everything's great, that's wonderful. Then the doctor knows what it looked like. And if there's a change, there can be an alert, you know. That
is incredibly important. Yeah.
Right.
Because if let's say that you're a high risk patient for glaucoma and it's been years and years and years since anybody's seen your eye and dilated, then we're looking at the optic nerve in the back of the eye and trying to understand what changes have taken place, if any. So it's really important to have a photo and some other testing so that we can put them side by side and say, has this person changed at all? And if the optic nerve continues to thin, that can cause blindness. So that's something that we have to get to. Once the nerve has thinned out, we can't get that back. There's no medication that we can give. There's not a magic pill or a drop that we can get that nerve fiber back. So that's why it's important to do a yearly dilated eye exam. Same with diabetic retinopathy. We want to know if there's bleeding going on so that we can help coordinate treatment with the primary care doctor and endocrinologist regarding where the blood sugar, the side effects of what's going on. The hemoglobin A1C, once it gets over 7, we start, and even before then, sometimes we start to see some bleeding in the retina. And the retina is like thin tissue paper, so it can come off the back of the eye and cause a detachment. So those are just a few things that, and not to mention macular degeneration. We'll talk a lot more on that too. So early detection is very important, and that's key. So, okay, let's talk just about some general lighter things like glasses. One thing is, for everybody, really, it doesn't even matter age. It's just every now and then you may doze off, you know, when you're watching TV and your glasses get a little crunched up, to put it nicely. And you can't believe, and in the corona, as we're all struggling through coronavirus and tending not to get out very much, it could easily be that you're not so much your vision has changed, but your glasses are the, you know, they need to be readjusted. And so that's something that opticians do free. There's no charge for it. Now, if there's a crack in the frame or something like that, and they feel like that could break, then they're going to ask you to sign a release. But it's a good idea to get your frame checked occasionally. And if you need new glasses, but you really do like your frames and you don't want to give that up, then have the optician check and see if those frames can be used again. The other hand, the slide says don't put expensive lenses in a frame that's going to break. So that,
yeah, I will tell you that, I mean, even when, I mean, I think that my husband probably went through more frames when the kids were little, from rolling around on the floor or somebody sitting on him or stepping on him or breaking on him or knocking him off of his face than he ever has now that he's gotten a little older. But yeah, I have been known to, I've been one of those people that has fallen asleep with my glasses on and woken up and had them all, you know, cattywonker. So they can get bent and, you know, it's miserable. So you're right.
Yeah.
It's nice to know they won't, yeah.
And the glasses that Bridgette has on right now, that's such a good choice because it's a very sturdy frame. And if you have younger kids, that's a good one to think about. And for our kids, there are many titanium frames that are extremely sturdy. I finally, after one of mine went through 2 or 3 pairs, we finally decided titanium is for him. We're not getting any glasses unless they're titanium.
Well, good job, Bridgette.
Yeah.
Thank you.
Job.
And you know what? I've had them for, I don't know, a little over a year, and I've never had a problem out of them. I like the plastic, you know, more durable one.
Yeah.
Yeah. So that leads into all the different choices out there. And some people really know what they want and other people are not so sure. There's some things that we have to think about for people that have Parkinson's, stroke, inner ear issues, traumatic brain injury. These are people that really should just be thinking about distance, vision only glasses. They would not do well probably for progressive. Even bifocal would be a stretch. There's the difference between bifocal and progressive. The bifocal has a line in it, but that prohibits you from seeing your computer distance. Whereas the progressive, there's no line, but you kind of get used to knowing that the distance is at the top, the middle is your computer, and the bottom is the reading part. Go ahead.
No, I have my comment I have around the progressives. I have progressive lenses, and the very first time I got them, when I had to move from to something where it was more than one layer, I did notice that it was really difficult for a few weeks on stairs specifically. And when I was golfing, when I was trying to hit the golf, it was just weird. And I was a little, I got a little dizzy, and it was a little hard to focus until I got used to my glasses, and I just had to power through it. But my doctor at the time said that was kind of an effect of the progressives, then I'm thinking that's why it is that you're saying it's probably not a good choice for people with balance problems. But it did go away, so my golf game didn't get any better, but
How long did it take for you to get adjusted?
It was probably under a week, a few days, based on how much, it was just moving my head and paying attention to that and looking, understanding whether I was moving my head or looking through the glasses at the right spot. So it took a few days, but because I really powered through it, and it wasn't all the time. It was just when I would do certain things. And then all of a sudden I looked, and within a week it was gone.
Oh, good. I was going to say, my husband had never worn glasses before age 40.
Yes.
Perfect eyes. But then age 40 hits. And
like a birthday present. It was like a birthday present. I turned 40 and like the next day. Tell your husband I feel for him, because I know exactly what that was like.
So I just could tell he wasn't going to be able to get used to progressives. So we put him in a trifocal, and just for the first year, and then he learned where to look. And then after the first year, he said, okay, I think I'm ready for progressives now. And now he loves them. So we can go slowly too. But there's also that group of people that can actually see great for distance, and they just need something for their computer and reading, because they're at their desk all day and they don't care about the clock on the wall far away. They don't care about the grocery store and where the canned vegetables are. They just need to sit there and function through their day as an accountant. And for those people, we have a type of glasses. It's kind of like a progressive, but it's just the computer prescription on the top and the reading on the bottom. And that's been very popular. And then there's a whole host of things that can be put on the glasses or incorporated into the lenses. The anti-reflective coating for glare, that helps a lot at night, unless you are compensating, trying to compensate for cataracts. And at that point, if you're having a lot of glare around headlights with an aura or glare around there, that means maybe you might want to come in for a cataract evaluation. Transitions are the ones that darken in the bright sunlight, and UV is what activates that transition. So it's not going to be very effective behind the car windshield, because the windshield blocks the UV rays. But it's great.
I've got transition lenses, and I would say that, they don't darken. I think they work really well to be able to help block some of the UV. So I'm glad I've got them, because I don't have to move back and forth between sunglasses. But I'm not sure that they work as well as, traditional sunglasses. They just aren't as dark. So I still notice that bright light is they're not as effective. But for 85 to 90% of my day, the transitions work great.
Yeah. And what I really like are the blue light blocking. That is incorporated into the lens, and it's very important to reduce the blue light rays coming off of the LED lights that are on your computer, iPad, phone, LED lights at work, at church, all around. These can contribute to macular disease, eye fatigue, and headaches. And especially for kids.
Yeah, that's really interesting, because my family, and we're going to talk about macular degeneration a little bit farther along, when my family has a history of my grandmother and my father both suffered from it. So I'm going to have to pay attention. Can you get the blue light blocking in addition to the transition and the progressives?
Some lenses, some companies you can, and some companies you can't. So
Okay.
when you go to talk with the optician, let them know you really want both.
Right.
And you can get that so that they know kind of which lenses to steer you toward.
That's a relatively new thing, isn't it, Doctor? How long have we had the blue light blocking?
It's been around a few years. Yeah,
Uh-huh.
but it's been the late, and gradually with every year we have more and more young people on computers, and now with COVID-19 everybody's on computer.
Right.
So now we really have to think about it. In fact, we have a lot of young people that don't need glasses for their distance or near, but they might have the tiniest little prescription, and we just go ahead and give it to them so that we can use the blue light blocking in there.
And that's a really good thing to mention about the kids today, because you're right, even children, and my grandchildren, several of them are wearing glasses, and one of them is just in the process of getting them now, and I might suggest to my son, I might text him later on today for him to consider the blue light blocking if he hadn't already, for my 5-year-old granddaughter.
Oh yeah. Yeah.
And correct me if I'm wrong, Dr. Consbruck, you can't see the blue lighting on the glasses, right?
If you hold it up to a white background, you can see the faintest little color of either a slight shade of blue or a slight shade of gray, depends on the lens. They used to be a little bit darker, and now they've kind of fine-tuned the technology so that it's barely perceivable. And they usually have a sample of the lens, so you can tell how exactly.
Yeah, I just received some samples from a vendor on the blue lighting little sample, like roll-on glasses. So
yeah. And I've been seeing it on the news too, that they've been covering that a lot now. Yeah. All righty, well, let's talk about drops, because that's always a question. Let's see if this will, okay. So the best way, let's say your loved one needs drops for glaucoma treatment or dry eye treatment, you name it. I always get this question, and there's a right way and a wrong way. So I wanted to cover this because, and there are, I'll go through several ways. So the first, wash hands no matter what. And now that we're in COVID-19 precautions, it's the amount of time it takes to sing the happy birthday song. And then you lightly pull down, well, you can bring your loved one's chin up if they're sitting in a chair. That's the position we're going to assume right now. So chin up, and then just making a little pocket on the side of your loved one's eye, and then hold that dropper close, not touching because you don't want to contaminate the dropper. And then dropping the drop closely into that little pocket area. And the reason you choose this and not over here is that there's not much room for that to go in over here towards your nose. So you want to get more toward the outer area. And then once the drop is in, do the other eye the same way, and then close, your chin still up, and then press in the corners right here. And there's a little hole right there that goes down your drainage area. So you want to, you're trying to just kind of put a little pressure on that very lightly, and then just wait a minute, like 60 seconds for that drop to absorb. And that way you're going to get a better efficacy out of the medication. The other way, and I also put in just squeeze one drop. 2 is going to fall out. So you're wasting the medication if you're trying to put 2 drops in. Then the other thing is, the other method is either with the person laying down on the couch or bed or whatever, to just drop with their eyes closed, drop a drop in the corner of each eye, and that's with their chin up a little bit, and have them blink, and then the drop goes in. Or you can do one eye and then put the drop in the corner, have them open, and then tilt their head to the side that you want the drop to go into. But the problem with that is that's great for kids because sometimes you can't get the drop in any other way. You know, that's the only way you're going to get the medication in this child. But the problem is, though, for adults, let's say it's for glaucoma, other issues, conjunctivitis, a bacterial infection, and we need that medication. We need all of the drop to be absorbed. If it's not absorbed well, and oftentimes it's not, because when you put the drops in when they're lying flat and you're depending on them tilting their head the right way, the drop's going to slide out a lot of times. You really don't know that you're getting the full amount in, and we need that full amount of medication in. So for that reason, that's a second best method. If you have to, you can go to that. And then there's a few little helps here. There's for people that have a hard time squeezing, they just don't have, like, weak arthritic fingers are a problem. Then there's an auto squeeze tool where you can, this is available at your pharmacist, that helps you squeeze the bottle. And then auto drop is another one that holds it in there so that you can get it in your eye better.
Well, that'd be really great if you're going to do it for yourself too. I would imagine it's, to try to do all of those things and not have somebody with you.
Yes.
That the auto drop might be a really nice option for people who know they're going to have to be doing these for themselves.
Right. Yeah. So that's something to think about. So let's move more specifically into different diseases that a caregiver could pick up on. And for macular degeneration, you'll notice, like, one of my relatives looked down on the ground and there was a straight stick on the ground. And she said, "Oh my gosh, there's a snake." And to her, it was a distorted stick, type shape. And she thought snake. So, and also if the person's having falls, if they're not reaching, something's in the center and they're reaching maybe to the side of it, then something's distorted and they're
with my dad, like I mentioned before, my dad had macular degeneration and it stayed dry and didn't move to wet. And I'd love for you to be able to explain the difference for those later on. But I did notice that towards the end, he was having a hard time reaching for, like, his fork. His hand would just be off just a little bit. Or I found him moving his head to be able to see, to be able to move his line of vision so he could catch everything that he was looking at. So I had a feeling that he was losing that central vision at that point.
Yeah. Yeah, they call that, when you're looking around, to try to focus in, as eccentric viewing, basically. So yeah, that's a good one. And then for glaucoma, it's somewhat the opposite. It's their peripheral vision that they may be bumping into furniture as they walk through because they're not seeing to the side. That can happen. Diabetes, the person may say, "Man, there's this red spot. It's kind of like a blotch or an amoeba," is what people describe it as. And if they're diabetic, then that could be a sign that there's some bleeding going on in the back of the eye. And that's, we need to know about. And diabetes can cause early cataracts. So they might see this glare that I was talking about a little bit earlier. And then for ocular surface disease, you may see them rubbing their eyes, itchy, dry, burning, or they're tearing like crazy, or crusty, a lot of crusty stuff around the eye. But that can be a bacterial type of conjunctivitis and other issues. So bring them in. Alrighty. And then it's just some things that we're considering when you do bring your loved one in, that as far as diabetes, of course, we're going to always look at their hemoglobin A1C, their blood sugar, and correspond to their doctor or their endocrinologist. But as a dietitian, I try to give a few little pointers. I don't have time to do a full out dietitian, instruction.
Well, maybe we can do that with our next one, Dr. Consbruck.
or a menu plan, for everybody. But there's some major things as far as diabetes. Fructose is one of the things that is like the all-time worst thing, because it actually works on decreasing the leptin, and that is something that is typically it's bad in that the hypothalamus can't get a satiety message saying, okay, I'm full now. So if you've ever noticed around Christmas time, all these Christmas cookies, I mean, who can resist? And the more cookies you eat, the more cookies you want. You know, it's like,
Yeah.
you just ate an hour ago and now you're already thinking about that Christmas cookie. And so it sets you up for a real bad sugar craving. So
Yeah.
that's something that we're trying to convey. Hypertension, high cholesterol. This is something we look for in the history. And then when we're dilating the eyes, we're looking for plaquing in the vessels of the eye. And that's something that can cause a transient ischemic attack, which is a precursor to a stroke or a mini
Oh,
stroke.
that's really good. You know, yes, absolutely. Just had a caregiver conversation around TIAs and strokes. And yeah, there's more than one of our organs that gets affected by high cholesterol and hypertension. So
Yeah. And the eye and the kidney have some very, very small vessels. So it doesn't take much to disrupt the functionality of those organs. For GI, we're always looking for a group of lesions in the back of the eye, something that looks kind of like bear tracks, little tiny bear tracks across the back. And those are associated with something called colorectal polyps. And there's this big long name, familial adenomatous polyposis. And it's an autosomal dominant inherited disorder. And it's known as Gardner's syndrome. And this can cause cancer. So it's not just looking for, you know, major diseases, but there are groups of things that we can find in the back of the eye that relate to other parts of the body. A melanoma, cancer in the eye, can then cause cancer, breast cancer or pancreatic cancer. It can spread from the eye to other organs, just like breast cancer can cause an eye melanoma in the retina or other places. So those are things we're looking for. And that's why we do a lot of history and want to know all about your loved one. And these are things, if you know your loved one's diabetic or hypertensive or has any kind of a colitis or anything like that, then these are things you could be on the lookout for. And then a lot of questions around what exactly is an emergency? What do I do? So let's say the person has, all of a sudden they're saying, there's one quadrant, it's black, I can't see through it. It doesn't matter how long, you know, if it's a minute or 15 minutes, it doesn't matter. Go ahead and take that person to the emergency room, because that could be a stroke. And there's the carotid Doppler, you know, a lot of things, testing needs to happen. So that's real, and as fast as you can, basically.
Yeah, well, and with transient ischemic attacks, the TIAs and the strokes, the quicker you can get your loved one to medical help, the better the prognosis is for there to be able to make a full recovery. And there are things that you can do if you've got a clot or if you've got things going on, if you can interrupt it fast enough, you might be doing more than, you know, you'll be saving their life, but you can also make the recovery so much better if you get them to the hospital quick enough. No, don't spend a lot of time.
Yeah. A bad fall, especially if the eye is bruising, you know, your whole area here is swollen, bruising. Pupil, if it's dilated, double vision, these are all signs that it could be a subdural hematoma. And, you know, we've had a movie star that died of a ski accident and never got anything looked at, and it turned out to be a subdural hematoma, and she died. So
Liam Neeson's wife, wasn't it?
Yeah.
Yes.
Yeah, it was Liam Neeson's wife. She was outside of, because my husband and I, we were living in New England, and I think she'd been skiing in Montreal, and she just thought she took a bad fall, you know, and didn't think anything of it. And right.
Yeah. So sad.
Yeah.
So, and then after the ER, typically we'll get the referral from the ER, or the patient needs to know to come in for a dilated eye exam. And what we're looking for is if during that fall, there could have been such a force on the back of the eye that it can form a tear, a bruise, a hole. A lot of things can go wrong that you'll never know, until we look in the back. Another thing is the foreign body to the eye. Now that's something that, depends on what the foreign body is, of course. But if you suspect that it's metal or something, tree, branch or something that's hit the eye and scratched it, that's something that you can go ahead and come on in for the Florida Eye Associate. But whatever it is, don't try to remove it yourself. That's the bottom line. I don't think I would have to say that, except that I've had a few patients that actually did try to remove it. So don't do that. It just makes it all worse. Painful eye, there's a lot of things that could be. So go ahead and come in quickly. If it's an angle closure, you can lose your sight. So that's really important to come in quickly.
So what's an angle closure?
Where the angle between the outer layer, the cornea, and the iris, the colored part of your eye, come together too narrow, and the fluid from the back of the eye can't get out. So it puts this incredible amount of pressure on the optic nerve, and that can damage it, and that can lead to blindness.
One thing before we move on, foreign body to the eye, I think that I'd love to be able to toss a little thought in there, is that when you do have somebody, if you're caregiving somebody and they've got something, is to close both eyes, cover both eyes, so it reduces the movement, I think, with their eyes. That would help, wouldn't it?
Yes.
On their way to the doctor?
Yeah, that would be good. So floaters, if you have a pattern of where you've got a floater or two and you noticed it, but then the next day you're having a lot of floaters, any kind of I meant to put on here a flash of light, veil over your vision, or a curtain, those are symptoms of a retina detachment. So we would want to dilate and make sure that that wasn't happening, rule that out, in other words. And the other thing, I'm not sure if you can see it on the slide, but a chemical splash to the eye, that needs to be brought in quickly to Florida Eye. You can go to urgent care. They will do a wash, an eye wash. If your employment place where you're employed has a eye wash, then that should be done immediately. So those are a few emergencies. And then not an emergency, but a real strange feeling, and you definitely want to get it checked out. That's an ocular migraine. You'll get the lights flashing, and you can see through it. You may have a headache, or you may not. You just may see this kind of geometric shape in your vision, or they call it a scintillating aura, where the lights are flashing kind of in a circular motion. Everybody kind of describes it differently, but that can be something called an ophthalmic or an ocular migraine. And the triggers are similar to a normal migraine: dehydration, fatigue, eye strain, caffeine, not enough caffeine, those sorts of things. And then with COVID, we're on the lookout for those really red eyes that can be contagious, whether it's for COVID or a viral conjunctivitis. So we want to come on quickly for that.
Yeah, if you're around babies at all, pink eye is so contagious.
Oh man.
Yeah. And it is just a bear to deal with.
Yeah. All right, so we'll switch gears and we'll focus in on the nation's top blinding disease, which is age-related macular degeneration. When we're talking about age-related, it's usually more like 65 or older, but that's a loose definition. By any definition, though, it is the leading cause of blindness in the developed world, and it accounts for more than half of all the blindness in the US. And this is a pretty old number, but from 2004, 8 million had intermediate dry and 2 million had advanced. It just kind of gives you an idea that there's a lot more intermediate, and wet is less. And we'll talk about the difference in a minute. And the early impact is loss, like we said, or distortion of the central vision. And we'll talk about how to diagnose that too. Who's at risk? Well, diet high in saturated fat, meat, butter, cheese. Cholesterol has basically what happens is you get the cholesterol kind of blocks where the rods and cones would flush out their byproducts, and that then causes the eye to not be able to pump out what it needs to pump out. And so you're starting to get cholesterol kind of seeping in through the back of the eye little by little, very little by little. And it's a long process, but still that can then lead to accumulations of drusen in the eye. And we'll look at that in a minute. So overweight, heart disease, cigarette smoking, over 50, having a family history of macular degeneration, Caucasian, early signs, like we said, the wavy lines where you can see the numbers on the clock, but you can't see the hands. So that central vision is decreased. Picture, I can't see my graduating, because I'm looking through that central. That's for somebody that's standing right there. They're not like way back in the audience or anything, but that's where the blurry vision starts. And one of the ways that we diagnose wet is where there's fluid in the back of the eye. And this is a picture of the macula, and the blue in the areas where you see the little bump up. That dark blue area there is fluid getting into the back of the eye. And so you can imagine if you're in a pool looking through water, how it's distorted. And so when you're looking through water in your eye, or it could be blood, it could be other fluids coming in there, your vision is definitely going to be impacted. That's wet. Dry is where you might see that bottom yellow line, or red, it would be red, kind of going up and down, and that's dry, where the fluid is not seeping in yet, but we're at risk for wet. Yeah. One of the other things we use is a fluorescein angiogram, and you can see on the photo here that bright spot in the middle of the area, that is leakage. And then they did a study. This was the AREDS2 that you'll see, like PreserVision is one of the supplements that's offered over the counter. And you'll see AREDS2 written on it. And that comes from the age-related eye disease study. There were 2 of them. So the second one was it was conducted in 2006 to 2012. And there were multiple combinations of the ARED supplement ingredients. It was an incredibly large test, or a large study, with 42.3 participants.
That's a huge study.
Yeah, they included age 50 through 85. That's why I said that 65 number is a little bit loose definition. And so they now believe that the AREDS2 supplement, in combination with food sources of lutein, zeaxanthin, can increase protection. That study did not study meso-zeaxanthin, but other studies have also said that's an important component to help protection. So the way that we treat wet macular degeneration is with an injection or laser treatment if it proceeds to wet macular. And the purpose is to reduce the number of tiny little vessels that can leak. We also, at some point, if it can't be controlled, and some of this is gradual, like as the disease progresses, we have Dr. Brown, who is great at low vision, helping with providing stand magnifiers or handheld computers, electronic items, telescopes, things that would really help a person be more independent. And of course, always the large print books, audiobook resources. So he's we refer a lot to him for that. And nutrition, let's talk about that. Foods that can help reduce the risk are, and the lutein and zeaxanthin are the main things that are important in that AREDS 2. There's more other things like copper and zinc, but let's just talk about lutein. There's a 10 milligram per day amount that's recommended, and that's in kale, collards, spinach, broccoli, corn. Zeaxanthin, 2 milligrams a day. You can get that through your orange and red bell peppers, broccoli, corn, carrots, tomatoes, all those things that Grandma said to eat. She was right. So here's a little comic. It says orange. I
love this slide.
Yeah, orange, yellow, red, and green leafy. That's what I was going for with this. But the comic says, my doctor told me to eat 5 fruits and vegetables every day. Today I had 3 raisins and 2 peas. And his wife looks at him like, are you crazy? But I liked that. That was by Randy Glassbergen. So I wanted Bridgette to kind of give us some information, or give the caregivers some information about what we have at Florida Eye Associates.
So I'd like to start and say that Florida Eye was founded in 1967 by a doctor by the name of Dr. Brevard.
Yeah.
It was the first ophthalmology practice in the county, and Dr. Paler then joined him not long after that, being the first subspecialist in the county, along with Dr. Freeman. Dr. Paler is also not only a cataract surgeon, but also is a retina specialist.
He did my mom's cataracts.
Oh, did he?
Yeah.
And everybody loves Dr.
She loves them.
Yeah. Dr. Freeman is one of our eye plastics. Again, fabulous physician. But those are just to name 2 out of the 12 that we have. Dr. Hirschberger, she does clinical trials at our practice on the wet and macular degeneration, for diabetic and macular edema. We also have, she also works at all of our 3 of our locations out of the 5 locations that we have. To name the rest of them, do I have 10 left, 9 left? We have 3 optometrists, including Dr. Consbruck here, Dr. Lalonde, Dr. Haft, and Dr. Brown. And what I like about Florida Eye is that if you come to see one of our optometrists and they see something that you need to see one of the specialists, you're here, you're in the building, you're with Florida Eye, and we have several locations that we try to make it convenient for everyone. In Vieira, Cocoa Beach, 2 in Melbourne, and 1 in Palm Bay. We also have our own
doctors, do the doctors move between those different spots?
We do have, some of them rotate around. Yes. Most of them do, actually. Dr. Paler, yeah. I believe, is our only one that stays stationary, and he's only at our Melbourne location at the 502 building. But the rest of them, yes, they do move around to different locations. So it's, again, we just try to make it convenient for everyone, all the patients. Mm-hmm. And it works out. It does well with as many locations that they have throughout the county. And during the COVID, our first priority right now, of course, is keeping everybody safe.
Right.
Especially our patients. We have an older clientele, patients that come in. And I know that it can be a little exhausting with all the questions and the screenings and so on. But it's really, for most people, they don't mind because they know that we have their best interests, and that's what we're trying to do, is just keep everyone safe, including mm-hmm. our patients. So
right.
That's all I have, though.
Okay. And the patients, I've really been, I mean, they've really been good about it. We have to, sometimes we get behind because we're trying to sanitize everything. every room, every chair, everything, every lens, everything. And it just takes time. And so, but I've always been amazed that the patients, they're just fine with, you know, I'll have them come in and sit down while I'm doing it, and we're talking through their history and things as I'm doing that. And our technicians are great to jump in there and try to help. And they're sanitizing like crazy everywhere they go to. So it's really been a team effort between our patients being nice, you know, about it, and then trying to do go the extra mile. But we're lucky to practice in such a wonderful community for that. You know, we have really nice patients. So, but yeah, so we have the locations, and also for, I've mentioned here on this slide that for Melbourne, the 502 location, and the Cocoa Beach location, which is in the square where we have Publix and Supercuts is there, some restaurants in the along A1A. Those patients, we have something called LipiScan and LipiFlow. So I'm going to talk a little bit about that and how that relates to dry eye. We have a team of, that's one of the things that I like too, is that amongst our anterior seg specialist, Dr. Haft, and then doctors for the Freeman and Ross for oculoplasty. We have a great team as far as dry eye. So I'm going to talk a little bit about our dry eye team and how we function. This is Jody Aracena, and we also have Hallie, and we couldn't get her picture quick enough, but this is the LipiFlow machine that we've been using. And Naomi Post, and this is something that treats dry eye, and I'll talk about that. But Naomi Post, this is her. She's our dry eye coordinator, and she helps book appointments and answer questions for patients. Bridget helps us also with that. Christina at Cocoa Beach is the office manager there, and she's been helpful too. Everybody kind of jumps in where they're needed. But we're excited about this treatment, and it relates to ocular surface disease. So let's say your family member is complaining of dry, burning, itching, tearing eyes, you know, and they feel like a cactus basically, and they'll come in saying, you know, I feel like something's stabbing me in the eye. Maybe it's a foreign body. We look and we say, no, you know, there's nothing in your eye. But as we can tell, as we go through the exam, they really are suffering from either dry eye or they're tearing like crazy because of some other factors, and we'll go through that. But basically, 502 New Haven Avenue is the address for Melbourne, and 2003 Atlantic Avenue for Cocoa Beach are the main areas where we do the dry eye clinic. And just some numbers for you for dry eye. It's huge. In 2016, there were 340 million dry eye sufferers worldwide. It's not just dry eye per se. It's things like when you're doing cataract surgery, you need that the eyelid to be as germ-free as possible. And if the glands are all clogged up and there's crusting and all this stuff around, that can cause an infection, and then the cataract surgery can go pretty bad. So this is helpful in looking toward any kind of eye surgery. This area around the eyelid needs to be really, really healthy. So this is part of what we do. And patients are getting younger and younger. We've had 7-year-olds, 9-year-olds that are miserable because of, well, when you're on a computer, you tend to blink less.
Right.
That's all of that. So the younger generation is really feeling it too. What we do is we scan the lid, the bottom lid. It doesn't hurt at all. We kind of turn it out a little bit so that we can see the glands, and we can image it. the imaging that we do is free. It just helps us diagnose. The medical exam, of course, is through your insurance or self-pay. But we're lucky to have something called a LipiScan, and it shows us where the glands are and where they aren't. And that's the important thing, is why aren't the glands, there the whole way across? You should have about 15 or 20 glands there, and on average, we'll see maybe 8 or 9. And so we need to understand, sometimes the glands are getting clogged up, and so we have a treatment regimen to help unclog that gland. And one of the ways that we can do it is through LipiFlow. So I'll explain that more in a minute. But who gets dry eye? Who gets meibomian gland dysfunction? These are meibomian glands that you are seeing on that. They look like little white piano keys on a keyboard, or white stripes. That's a meibomian gland. And it's responsible for producing and generating this oil material that's a lipid, so it's kind of a fatty substance, and that goes on the eye. If it doesn't go on the eye, then your tear can't stick and it falls off or evaporates. So it's very important to have that lipid material out of that gland and onto your eye. The more material, the more lipid, the less dry your eyes are. So who has this meibomian gland dysfunction problem? I'll go not through the list entirely, but glaucoma patients, diabetic patients, computer users, cataract patients, and contact lens wearers. Those are a large part of the population. And of 86% of all dry eye is because of meibomian gland dysfunction. So that's why scanning those lids and looking to that. Moderate meibomian gland dysfunction will progress to really severe if we don't do anything about it. And at that point, we really can't do anything about it. Once it becomes severe, we can't get more glands. They just, once they're really, really gone, they cannot regenerate back. So when it's severe, that's the type of person where they're very, very sensitive to the light. Their house may have the blinds are closed, the curtains are drawn, and also their vision is fluctuating too, because
but it does sound like if you catch it early enough that it's reversible, that these glands can be caught if you get it close fast enough, that you can regenerate these glands. So that's good to know.
Yes. So we have this is a picture that the LipiScan did. This was actually very first patient, and she actually has no glands along this. The right side of that screen is her nose, so she doesn't have any nasal glands there. So what we did is this is the left one too. You can see there's no nasal glands there. So she said, "I've tried everything." And she gave me permission to talk about her case. She came in and she said, "I've tried everything. I've done all the different drops that anybody could ever think of. I've done plugs, I've done everything, and nothing works. And there's got to be something else out there." So we said, well, we just started doing this treatment called LipiFlow, and it warms up the lids to 108.5 degrees, and then it does kind of a little massage for about 12 minutes. It doesn't hurt at all. So she said, "Sign me up, let's do it." So we did her the next day, and then she came back 2 weeks later and said, "I really wish, I don't know whether to be happy or sad. I really wish we could have done this 6 months ago." And we, of course, well, we didn't have this machine 6 months ago. So that's what we were onto something. And so that's how it works. It's called LipiFlow. It warms everything up, and then it pushes out the blockages for you. Yeah. So that's kind of, there's a little applicator. It has a computer chip on it. And then there's a cable that goes into the machine that you saw earlier. And it's computer driven. Not too bad. This is another patient that gave me permission to show her photos. on the left side is before, the right is after the LipiFlow. It's kind of a comparison picture because the right side, we actually were able to pull her lid down further, but in all, there were a lot longer revitalized glands after the LipiFlow, and she felt much better. This is another condition called blepharitis or Demodex. This is an area where either you'll get a lot of debris along the lashes at the base of the lash, or you'll get actually like a little egg looking thing, or even I should have brought the little Demodex is a mite, and you can actually see the tail coming through the lid, not to gross anybody out, but
yeah,
it's a mite. It's a mite, and the tail's wiggling, and it's absolutely miserable. And it doesn't have anything to do with really their hygiene. They're clean.
Right.
They take a shower every day. It's not that. It's just that we've got to get rid of this mite, and it's also, you'll see eggs toward the clear, like a little round egg at the end or somewhere along that eyelash. So they're miserable. So we use something called Blefex, and it's like a little thing that has a brush on the end, and it goes around and around pretty quickly. And it doesn't hurt at all. It is a little tickly. So, and then we have patients that are just coming in for that treatment. They know, sometimes we just say come back as needed, because we know they're going to come back about every 4 to 6 months and have that treatment done and they can tell immediately they feel better. And it lasts about 4 to 6 months.
Good to know people don't have to suffer with that.
Yeah, because it's an itchy, burny, really uncomfortable feeling. And what we're doing is we're removing the Staphylococcus bacteria, and we're removing a lot of what's called biofilm, is where your lid produces just the cells, and bacteria begin to block up the glands from the outside. And the LipiFlow is more reducing the blockages that happen on the inside. And sometimes we do both of those. And then so just some quick tips about nutrition for ocular surface disease. You'll hear a lot about omega-3s and omega-6s. It's a fish oil capsule. It's just by mouth. You don't put it in your eye. But, well, there is a drop called Refresh Mega. It's a preservative drop that has some omega-3 in it. But otherwise, the capsules, though, you take by mouth. And we recommend, this is an anti-inflammatory it helps cardiac conditions, but mainly we're looking at which one is the best one for dry eye or ocular surface disease. So we'll go through that. But the exception would be anybody on a blood thinner like Xarelto, Eliquis, Coumadin, warfarin, not really so much aspirin. But those are the biggies there. And then of course, if they have a fish allergy, they're mostly fish oil. So you don't want to have that. Let's talk about that. Well, omega-3 is a fatty acid. And what the main thing is in your omega-3, you want to look for one that has alpha linolenic acid. And all of them do. This is something also that you find, other sources of omega-3 would be walnuts, flaxseed, canola, and soybean. These are things that also convert to something called EPA and DHA. Those are important. The EPA is what is the anti-inflammatory. And DHA, they've done a lot of studies on that, and they're trying to understand, could that help Alzheimer's and some of the ADHD in kids, and the jury's still out on that. They're still researching it. Anyway, omega-3 and 6, the recommendation is 1,500 to 2,000 total milligrams a day. And other food sources, salmon, tuna, herring, orange roughy for omega-3. Then let's see. Oh, okay. So with walnuts, when I say walnuts, I'm not talking about on a donut or peanut, on a donut. That kind of negates the whole thing. I'm sorry. This says, another Glassbergen comic is, it says, of course I can eat donuts on my diet. My doctor says nuts are good for me. I'm not saying that, but so along with that alpha linolenic acid from omega-3, we also need something called gamma linolenic acid, and that's from omega-6. You need a good balance of that. Gamma linolenic acid is mainly from plant-based oils, evening primrose oil, which you have to be careful for. I'm not careful of. I'm not advocating going out and doing a lot of supplementation of herbal things, but borage oil, black currant seed, these are the things that make up a gamma linolenic acid, and that's incorporated into the omega-6. We have a product called Hydro Eye, but you don't have to use ours. You just look for anything that's got the alpha and gamma linolenic acid in there. And then there is a omega-3, 6, 9, which the 9 is oleic, but that products for vegetarians or people that are allergic to fish. So that doesn't have to be a barrier. And that pretty much is the bulk of everything. This is a number that you can contact us at 321-727-2020. And in conclusion, I did an exam on Mr. Redlegs in Cincinnati, and to promote the idea that a yearly dilated exam is really important, and it can catch a lot of warning signs, flashes, that sort of thing. And then don't gamble with your eye disease. Even if you're thinking, should I, shouldn't I, just come on in, because you need an yearly eye exam, and chances are you'll walk away just with reassurance and glad you came in. So then, and then watching your food choices is important for healthy eyes. These are my parents and my daughter. My daughter works, or did work, at the Cincinnati Apple store. And so they came
there you go.
looking at watches. They didn't walk away with a watch, but they had fun trying them on. So watch your food choices and take the time. And there's so many beautiful things in the world. This is the Oculus in New York City, just behind the monument from 9/11.
Yeah, the World Trade Center.
Yeah, give us a call if you need anything, or just have questions.
Oh, I thank you guys so much today for a wonderful, in-depth discussion about what it's so important to take care of your eyes. I don't think it's one of those things that I think that that once you start to lose it, you really regret it, because there's, as your independence and isolation, your ability to do things is so hooked to our ability to see. So you don't want to mess with that. People want to stay as healthy as possible. So you need to take care of your eyes, you need to take care of your hearing, you need to take care of your teeth, all of those extraneous things that we don't think of, and necessarily with our yearly physical, with our PCP. These are things that really do pay dividends if we pay attention to them. So I thank you.
Well, thank you for the opportunity to present.
I thank you so very much. And this has been a wonderful caregiver conversation. And I hope to be able to work with both of you again on another conversation sometime down the road. So thanks so much.
That'd be great. All righty.
All right. Bye-bye.
Thank you.